So good morning. I was asked to give you a quick overview of what we have been doing at the Foundation since the last couple of years. And I thought to call this presentation about impact. So on the first slide, of course, the thing that matters most to all of us here is how fast can we get clinical trials? How fast can we get drugs to the clinic, to the patients that in fact can or may benefit from this? So the NF Preclinical Consortium, which is an initiative that the Foundation launched 10 years ago, was really an initiative of bringing, I don't know how much you know about drug discovery, but typically what you do is that you first need to understand what makes the patient sick. Once you understand what the mechanism is that makes the patient sick, then you start thinking about what can I do to stop this manifestation, to stop this disease manifestation. You give the patients drugs, which are molecules that are in large pharmaceutical or small pharmaceutical companies. You treat, the first thing you do is you treat the sick cell, because then you can look at a lot of drugs, because cells, you can put them in this all these multiple, what they call well plates. You can test millions of drugs very quickly. And then once you start seeing that you have an effect on that sick cell, then basically what you do is you model the disease in an animal, and then you give the drug to the animal to make sure that you cure the animal, between brackets. And then once you have cured the animal, then you are ready to go into the clinic with you still have to do a lot of studies in between, but this is kind of the overall process. So the Foundation in 2008 created a consortium, which is called the NF Preclinical Consortium, which was a fantastic idea. This was multiple academic centers that were brought together, and the common goal was, instead of looking at one animal study after the other, they put some animal modelers in one room and said, this is a drug, look at on what it works. So you can imagine that saves a tremendous amount of time. So we did about 116 of those drug studies in 10 years. Normally it takes forever to do one, because every time you have to wait for the result of the other one to move forward. 16 of those trials have led to clinical trials. The other investment, the MEK inhibitor, probably people have heard about it, the selumetinib, extremely exciting study that is happening at the NCI under the leadership of Brigitte Wiedemann. We have helped make that happen. We have made some investments in showing that, in fact, this mechanism really is effective in inhibiting tumor growth or even reducing tumor growth. And now the last kid on the block is NF2 Synodos, which is another of our crazy consortia ideas, has in fact led to clinical candidates. So we are pushing stuff to the clinic, and we're always going faster and faster. While we have been pushing drugs to the clinic, we've built a couple of assets, and those assets are extremely important because those are the things that pharmaceutical companies are really looking for to get engaged into a new disease indication. Pharmaceutical companies, and for those of you in the room that are in pharma, I apologize upfront, but they're a little risk averse. So the more we can help them kind of answer questions that they have and reducing their resistance to enter into a disorder they were not planning to enter in, the faster and the more engaged they get. And the real drug development process is actually happening in pharmaceutical companies. So you know about the NF registry. We also built an NF biobank. We have now large animal models, and those are 2 pig models that were developed for NF1, and you may wonder, why do you develop pig models? Well, what is happening is that the mouse is not a patient. Now, a pig is not a patient either, I hear you say, but if you look already in the medical field, a lot of pig organs are used for human, right? The heart valves, you name them, there's a lot of pig stuff that is used for human application. So in fact also pig metabolism is much closer to human metabolism. So these pigs are really used to get closer to what is happening actually in the patient, and it helps us select even better drugs to go into the clinic. So now we have 2, and there's others coming, funded by other funders. As I told you before, the NF Preclinical Consortium, the NF Conference, for those of you who don't know, we started very small in the 80s with a couple of people around the table. This year we go global, and we are expecting, Patrice is leading that, she's the fearless leader of the conference, and we are expecting about 700 registrants in Paris. So we just grew the community by a little. just a little. We have a large key opinion leader network. A lot of those key opinion leaders are in the room with us today, and I would like to deeply thank them to be so engaged and so helpful. But the network is even bigger than the people that are in the room. We have created an NF data portal that Salva's leading. It's really at how much can we get all the NF data in one place so that we can actually study much bigger things than if all these data sets are everywhere, right? We're also co-funding that now with some other NF funders, so we're really getting not only we're pushing the researchers to work together, we as funders are also coming together, and Tracy Virtanen is leading this, the NF Collective, which is also bringing multiple NF funders together to do stuff together to go faster. And then, as you know, we created our NF Teen Science model. Just to give you some numbers. So, for those of you who are in the investment industry, we're doing pretty well. If you looked at over the last 5 years, we invested about 26, 27 million, and we got 38 million back. So that's pretty good. As I said before, we're expecting about 700 registrants at the conference, and that is exactly doing what Ono was just saying, like how can we get people attracted to this disease area that they were not part of? How can we get bright minds? How can we grow this community with smart people? And this is something that I think this is all of our role. This 15,000 citations, we had about 300 publications that came out of the investment that CTF has done. But that, in fact, 15,000 citations means that people are actually reading what we're doing and they're using what we've been funding. So that kind of gives you an indication that we're really investing in quality science. For those of you who know the NF Clinic Network, that is 54 clinics that see on a yearly basis about 14,000 patients. We have the 116 preclinical trials, and as I said before, we have our 2 new pig models. That is pretty exciting, and they really have the symptoms of NF. We have a first partnership with pharma. We have a partnership agreement with SpringWorks, which is a spin-out of Pfizer. Pfizer saw that, in fact, there was a lot of MEK inhibitors out there now, and they didn't see the commercial advantage of keeping the development of the MEK inhibitor. That is, I mean, there is always that fight between the science and the commercial when you're in pharma. And in fact, what they did is they spun out a company, which is called SpringWorks, who is dedicated to develop drugs for rare conditions. And we are one of them because we have been advocating very heavily, both on the Pfizer side and on the SpringWorks side. Schwannomatosis was kicked off last year. Nobody believed that we could have more than 10 samples in one place. Well, we have over 100 now, and we're starting to see some very interesting mechanisms that are associated to pain. As I said before, the data portal, we have about 6,000 data sets in the NF data portal. And just as a very good news, yesterday or 2 days ago, the publication came out of NF2 Synodos, and those data sets for NF2 are openly available now for everybody, even for you. We have 6 cell lines that are open and usable for all. A lot of the tools that are developed in the academic centers stay in the academic centers and need about 70 lawyers to get it out there. This is unfortunate, but that's how it works, and it's nobody's fault. It's just that this is how the system works. So we have started to develop cell lines now with some of the academic centers, because there is a few, but very courageous academic centers that say, you know what, this is the system, I'm signing up to something new. And I can tell you that in the NF community, we have a lot of those courageous scientists. So I really would like to applaud that, because this is how we're going to change the world. And we have in the Synodos, in the team science, 40 labs that work together and share all their unpublished data together. Just for you to know, a publication for an academician is what is their career, because a publication makes you respected. Once you're respected, you get easier access to funding. So the publication is your bread and butter. So the fact that these 40 labs are willing to share their unpublished data is pretty amazing. And I want you to realize how special this NF research community is, because they are. Talking about care, as I said before, we have 54 clinics that see about 14,000 patients. The clinical group, under the leadership of Pam, in our foundation have organized about 22 educational sessions, again with the centers across the US. We have patient one-on-one calls, so if you have questions, Kate is our registered nurse. Kate, are you in the room? She's outside. Okay, sorry. She's taking care of people that are coming in. But anyhow, so you can talk to Kate. If you don't find Kate, ask me. I'll introduce you, and you can call Kate with questions that you have, that you want to talk on a one-on-one. Kate is also organizing Ask the Expert webinars. And then the whole clinic network is run by Heather. And then, as you saw with Trey-san is our fearless leader in the whole patient engagement program. And then together with the Clinical Care Advisory Board and the communication team, we've developed quite some interesting educational brochures. What we would want to hear is, we want to hear your voice. If there is anything that you are puzzled about and that you wish we could create a brochure on, please tell us. We won't be able to do it the next day, but we will definitely put it in as something that the community is looking for, because that's one of the things, that's the input that we need from you. And then we have created the parent guidebook, which is an interesting book that really helps you understand, and also for parents with kids with NF. Advocacy, together with the other NF organizations, we have secured as an NF community $300 million now for NF research. And over the past 6 years, we could secure $15 million funding still every year. That has been challenging. As you can imagine, the defense budget is not so enthusiastic sometimes about funding disease-focused research, but with our leaders, Tracy is on the hill with, I call her the carpet bomber. She goes in with 400 or 500 patients, and when we come in afterwards to go to some specific offices, they're all like, yeah, we know NF. So I think Tracy's doing an amazing job in jazzing all these offices up. Quality. One of the things that I wanted to share with you is that the quality of the foundation, I have to say that I'm very proud of that. We have been 9 years in a row. We hope we'll hit the 10 next year. 4-star Charity Navigator. It's like a TripAdvisor for nonprofits. But we're coming out pretty well. It's how you manage your operations. It's how much money. So 80% of our money that comes in goes out. So that's a tight ship. And so that makes us that we get this 4-star. I don't want to say exactly, Simon. What is the percentage of people that get 4 stars for Charity Navigator? Do you remember?
Very, very small, just a few percent. We're in the top 2% in the country.
Just bragging a little bit. No, but I mean, this gives you a feeling that we're considered a quality organization, not only by ourselves, but also by others. We just won the Best Place to Work in 2018, a couple of weeks ago. We are in the 5th best places. We're number 32, but if you look at that combined with 4-star Navigator, I think there were 3 or 4 only. So I'm pretty proud of that. I don't want to go too deep into the quality of science that we are funding, but the 15,000 citations is one of them, and then Salva can tell you everything about registered reports, which is really a way of funding great research and getting great publications out there. And then, of course, we have these internal operations that are running really very smoothly, and although these people do a lot behind the scenes, I feel that I wanted to talk about that today. So talking about the cultural shift, I loved Sarah's quote from Steve Jobs, because I think we're truly changing the world, and not only us at the foundation, but all of us in this community. We're really following the shift in thinking. I really liked Vanessa's slide saying, you went from a more driven by the clinician research to now real exchange. We're really following that movement where we really consider our patients as partners. But we want to make sure that you are understanding, and it's like learning a new language, right? You need to learn that science language in order to be really contributing and understanding what you're actually participating in. So that's the patient research training program, the NF registry, and the NF biobank you've heard about. The NF camp is another program that I'm really proud of. It's a program that is led by Julie. Julie Pantiliano is leading that. And what is really cute, and just to say you also how our kids are becoming partners now. So NF Camp has been running for over 20 years. And over the last 2 years, the older NF campers said, we would like to mentor the younger kids. And it is absolutely stunning to see how these older teenagers are really helping the smaller kids with their struggles in NF, and they really have that parent, if you want, that they can talk to about their things, big or small. It's a very, very touching program. And then, as I said, we have our team science. Talking about creativity, I think we can get a 4-star in creativity in this community, you and all of us. Social media, media in general, these proclamations, NF Awareness Month, I Know a Fighter, all these events like endurance, walk, community, volunteers, support groups. I think I'm extremely excited how engaged everybody in this room is about getting NF out there and getting the word out there. And what you're doing is extremely important because it will make NF known. If NF is more known, we will get more funding, and if we get more funding, we will be able to go faster. So what you do is absolutely incredible. As I alluded to some people, NF has no border, and neither do we. You know that we've always, or you don't, but we've always been funding globally. All these team science are all global consortia, all the science that we're funding. We have no borders in our money that goes out. We just now became an associated partner for a European initiative, which is called the Innovative Medicines Initiative. We have our global conference in Paris this year. We will be planting our flag in fall, probably right after the conference, because of this collaboration with the European partners, and because we are participating in a big European NF call. It's all about growing the community, right? More people work on NF, the quicker we will be able to identify stuff. We visited China with my board member, Richard Saul. That was a very interesting experience, both culturally and also understanding. In China, just to give you one number, there's about 500,000 people estimated that have NF in China. I visited the 3 centers that take care of NF patients, and that was over total, when I did some math on the back of a beer cart, was about 2,000 patients, just to see what the unmet medical need is. And what kept coming back was people don't know what NF is. There's a ton of patients that have NF that don't even know that they have NF. So we have an awareness role here, all of us. Are we done? No. We have to keep growing, keep going. To do what? We need a second phase in Synodos. We've done amazing things in Synodos, and I think Salvo and his team has led this amazing initiative of going faster and getting research that can be more efficient. We don't want to interfere with the discovery, but once something is discovered, we really want to translate quickly into clinical benefit. We want to keep going with the NF registry, and as Onno was alluding, we're going to modernize it a little bit and making it a little more fun and more engaging. We want to keep going with open data in the biobank, and of course, we want to keep going and expanding the clinic network. We want to do some new stuff. We want to build a discovery fund. The foundation has always funded research, both basic and translational and clinical research, so we've always funded that. And Melissa came up with the idea of why don't we create the discovery fund so that people can actually donate to the discovery fund and that we can fund the research where needed. We have what we would love to do also is build an NF clinic mentoring program. As you probably saw, if you look at the clinic network, it's very, my geography is horrible, but I can look at the dots, and it's very East Coast and West Coast, and in the middle there is a lot of empty spaces. So the idea that the Clinical Care Advisory Board together with the clinical team came up with is what if we would create a mentoring program so that even if the clinicians are in places where there is no clinic, that they can actually get access to the knowledge that our top centers have access to. And then one of the other things is we want to develop some kind of return on investment. If we help develop a drug for a company and that company makes $1 billion of that drug, we want a little piece of the cake. So that's a change in culture, which is interesting, and it's hard, but we're trying to do that. And you need to be persevering. So in conclusion, we've accomplished a lot. A lot has been done. There is a lot of hope, but there is still a lot to be done. And you're part of something really, really, really big. So thank you so much.